All right, it's a few minutes after 8, so we will go ahead and get started. Welcome, everyone. My name is Sydney Dale McGrath. I'm the project manager of the Better Nights, Better Days research program coordinated at Dalhousie University in Halifax, Nova Scotia, and I'll be moderating this discussion this evening. So thank you for joining us for this virtual panel featuring researchers from the Better Nights, Better Days team of investigators. This event is being held in recognition and celebration of World Sleep Day, which is on Friday, March 19th, and as well to mark the launch of a national study funded by CHR titled Scaling Out Better Nights, Better Days to Help Children and Families Go from Surviving to Thriving During COVID-19. The panel period itself will be approximately 30 minutes in length, and we will then open the floor to the audience. So feel free to share any questions or comments at that time using the chat function, which will then be addressed by the panelists once the discussion concludes. And you may also raise your hand if you would like to ask a question using your microphone, and we will invite you to unmute yourself at that time. We would ask that you please mute yourself during the panel conversation and turn your video off as well. As part of this session, we have organized a door prize, which is a cozy and relaxing gift basket. And we will be randomly selecting an audience member to receive this prize at the end of the session. So be sure to stay on the line until it concludes for a chance to win. And a final note that this event is being recorded and will be shared publicly. So I'll introduce now our expert interdisciplinary panel. Dr. Penny Corkum is a registered psychologist and a professor in the clinical psychology program with the Department of Psychology and Neuroscience at Dalhousie University. Penny is the principal investigator of the Better Nights, Better Days implementation research program, and her clinical practice, research, and teaching are in the area of child mental health disorders. She has a particular interest in ADHD and sleep problems in elementary school-aged children, and Penny is the director of the ADHD clinic at the Colchester Regional Hospital and an affiliated staff at the IWK Health Center. Dr. Elizabeth Keys is an assistant professor with the School of Nursing at the University of British Columbia, Okanagan. Elizabeth is a registered nurse with a clinical background in community and public health nursing focused on promoting child and family well-being in the community. And the goal of her program of research is to promote and maintain infant and parental mental health by supporting parent-child interactions and sleep health using innovative models of care such as eHealth and precision health. Nicole McKenzie is a second-year PhD student in the clinical psychology program at Dalhousie University. She completed her BA in early childhood studies at Ryerson University and a Master's of Education in developmental psychology at the University of Toronto. Her research interests within pediatric pain include interventions for procedure pain management and how knowledge translation can improve families' access to evidence-based practices for pain management. Nicole's current research is focused on understanding how parents engage with and use knowledge translation interventions to better facilitate the uptake of evidence-based strategies to better manage children's pain. And finally, Dr. Shelley Weiss is a neurologist at the Hospital for Sick Children and a professor in the Faculty of Medicine at the University of Toronto. Shelley's clinical work focuses primarily on epilepsy and sleep neurology. She has been involved in evaluation of children with sleep disorders for more than 20 years and currently directs the neurology sleep clinic at Sick Kids. And her research interests includes the management of childhood insomnia and the interaction between sleep and epilepsy in children. And Shelley was in 2019 appointed as the North American representative of the Governing Council of the World Sleep Society. So to start the session, Shelley will share some information about World Sleep Day.
Great, thank you very much, Sydney. So I'm Shelley Weiss. Thanks for joining us tonight for this virtual panel. So the World Sleep Society, you can actually look at their website and you can see all the activities that they do. And the goal is to advance sleep health worldwide. So it's a perfect marriage between tonight's talk and World Sleep Day, which is tomorrow, because this is so important to talk about sleep in children. There actually are many countries that participate in the World Sleep Society. 88 countries have participated so far. And if you look at the website, you'll see all the activities that are happening tomorrow. So welcome, and we hope you enjoy this panel discussion.
Thank you, Shelley. So Penny, would you be able to start us off, tell us a bit about why the Better Nights, Better Days program was developed and how the program works?
Sure. First of all, hi everyone. I'm really excited to see people join. Some names I recognize and some I don't. So welcome to those folks that are familiar and those that are new, and really happy you could join us tonight. So for some of you already know this, but for the people that don't know it, I have been leading the Better Nights, Better Days project since its inception, which is actually quite a few years ago. If you don't maybe know a little bit about I'll tell you a little bit about the kind of landscape for sleep research over the last 20 years. I'll do it in like 2 minutes. So for a long time, there really wasn't a home for sleep research in our national funding strategy. And about just over 10 years ago, there was a specific call to really promote sleep research in Canada, and myself and a national group of clinical scientists who focus on pediatric sleep were successful in receiving this grant to help us to support us in developing, evaluating, and then disseminating and sustaining e-health interventions, so which was Better Nights, Better Days. And on the slides that were going before we started was a picture of all the different co-investigators. So we really have a top-notch group of clinical scientists who contributed to the development of the program. And the idea behind it was to make an accessible program. We really wanted to be able to have parents be able to access the information when and where they needed it. So because it's e-health, it's internet-based, they can log on whatever time they want, wherever they want, and it's responsive design, so they can use their phone or their tablet or their computer. And so we were excited to develop it. It took a lot longer than we thought. We had planned 6 months and it took many years, but I think that we developed a really great, engaging e-health program. And we evaluated that through a randomized control trial across Canada. And it took a couple of years to do that. And we're just now finishing up the primary analysis and getting ready to publish it. But a sneak preview is that it was effective and not only improving the children's sleep, but also their daytime functioning. So that's really exciting. And so that's kind of the story of Better Nights, Better Days. And we've since modified it for families of children with neurodevelopmental disorders, and now for the COVID context.
Thank you, Penny. So recognizing that sleep is a concern for many families, in the current global context, Elizabeth, how has sleep changed for children and their parents since the start of the COVID-19 pandemic?
Thanks, Aline, and hi, everyone. So I think that's a great question and really relevant. I think before even the pandemic emerged, we knew that sleep disturbances like insomnia, which is difficulties falling asleep and staying asleep, were highly prevalent in children before the COVID-19 pandemic, with about ranging in 20 to 30% of children experiencing that. And then early on in the pandemic, we did hear, we're seeing some emerging reports from other countries that had higher rates of COVID-19. So in China and in Italy, if you remember, those were some of the big, the countries that were hit hard first. And they were reporting that there was people in those countries that were having trouble sleeping. And so we wanted to look at in Canada to see what kind of effects of not necessarily COVID-19 or the virus was having on sleep, but more the conditions that we were all experiencing, so that were associated with the public health measures. So mainly staying at home, not having or not being allowed to go to school or childcare. And we thought that there is a chance that it might be making, having children may be experiencing more positive changes in sleep because they weren't needing to go like be up for school at certain times. But then there was also a lot of stress and anxiety, which we know is associated with sleep. So we thought there might be a negative effect on sleep. And some early reports in Canada came out that indicated that perhaps children, their sleep duration was increasing during the COVID-19 pandemic. So that kind of makes sense in terms of children not having to be up at certain times for school. And then we wanted to dig into that a little bit more. So we looked at, we did a follow-up study with people who had participated in the Better Nights, Better Days randomized controlled trial in June of 2020. And it was a relatively small survey, so just 85 parents, where we asked them to let us know how things were going. About half of those parents had participated in the Better Nights, Better Days program, but the other half hadn't received the program. They just were controls, which is mean they gave us information about their sleep, but they didn't get the intervention program. And so what we found was that parents were reporting, about 40% of parents said that their children's sleep had worsened since the start of the pandemic. There's a small percentage of number of children whose parents thought that the child's sleep had improved, so about 14%. And then a good chunk of 46% of parents thought that the pandemic hadn't affected their sleep. And we thought this was really interesting opportunity to also ask parents about their own sleep. So 60% of parents had said that their sleep had changed for the worse as well. So these are significant portions of numbers of families that, subjectively were saying that their sleep and their children's sleep had gotten worse.
Thank you, Elizabeth. That is quite significant. So Nicole, perhaps you could speak to how families have been coping with these changes and sleep and routines brought about due to the COVID-19 pandemic.
Absolutely, I'd be happy to. And hi, everyone. I'm happy to speak to this topic as well from my experience working with Dr. Corkum and her fabulous team on this. So kind of picking up on what Elizabeth was just commenting on, this was, of course, a very challenging time from both the parent and the child perspective, particularly where sleep was involved. And so we know, as Elizabeth said, that there were significant concerns that parents and their children were experiencing when it came to changes in their sleep, especially those for the worse. And so when we think about this from the perspective of sleep and routines, this was a really interesting conversation that I was having with many parents through our qualitative investigation of this particular area. So we know, of course, we can even think for ourselves, we all experienced really significant changes within our own routines and schedules. So not having to go to work at the same time every day, being in a new environment, for children not going to school at the same time that they were doing that, and really just changes in normal responsibilities around the house as well. So what's interesting is what seems like a bunch of small changes actually amounted in a pretty significant concern for many parents from their perspectives. So when we think about how routine and structure can really impact sleep later on, we came to conceptualize this kind of as having a two-part component. So we can think about structure in the daytime hours where, as I mentioned, there wasn't that expectation to be at school or at work at certain times. And so those expectations to be up at a certain time and back in bed at a certain time were functionally removed. And so that disruption in the daytime then kind of led into what became disruption in the evening as well, and changes in these bedtime routines that we heard parents talking about when their kids weren't on their normal schedules. So in terms of sleep and in the evening, what this looked like was these shifting sleep schedules. So where a child may have normally been going to bed at 8 o'clock, for example, slowly this was slipping later and later. So we see this shifting of bedtime happening. And then in the morning, we're seeing a later wake up as well. So while the case may be that kids are still getting similar hours of sleep, we know that that shifting in bedtime routine is not, characteristic of good sleep hygiene there in and of itself. So really what's interesting is parents were noticing that it was kind of when things were becoming a bit chaotic in the daytime with no expectations, lack of routine, we're then seeing this effect happening at bedtime and with sleep as well. So that was what was happening in kind of, I suppose, a more negative light with these kind of challenging shifts in routine. And so that made it very difficult for some families to get back on track. But what was really interesting is that many parents were able to adapt to our new favorite phrase, the new normal. And so there, when families were able to kind of recognize that, okay, this is how things are, this is what we need, and we need structure in our family. It was when those new routines were put in place that we saw things, or parents described their routines as coming back down to normal, and children's sleep kind of going back to this regular routine, and there being some restoration of good sleep routines there as well, which the cascade happens again in the daytime, where they were able to spend more time together in the day, taking advantage of some nice aspects of the pandemic in terms of being at home too. So that power of routine was quite clear in speaking with parents for the negative effects on the evening component, but then also when those get adjusted, some positive effects there as well.
Fantastic. Thank you, Nicole. So we understand that the pandemic is certainly impacting sleep, and at least some families may be struggling to respond to these changes. So Elizabeth, are there any new program components in the Better Nights, Better Days intervention that are specific for the COVID-19 context?
Thanks, Sydney. There is. So as Dr. Corkum mentioned, we spent a lot of, the original BNBD program took a long time to develop, and we added in a few components this fall to layer in, recognizing, this is not implementing Better Nights, Better Days and this 24-hour kind of approach to trying to improve your child's sleep might be harder to do in the stress of the pandemic. And what we did is we created kind of an introductory, gentle session that kind of contextualized some of what we, was emerging in the literature in terms of, what to expect for sleep during this new normal, or just kind of normalizing it for some families as to, it's okay if it's been it's started to be a problem during the pandemic, and also trying to give some extra supports because we know it's just such a stressful time for so many families. So that was the first kind of component that we added in. The second component was aimed at addressing or trying to address and support the huge percentage, maybe it's not huge, but it seems huge to me, 60% of parents who in our little survey said that their sleep had worsened since the pandemic. So, approaching sleep in children, a lot of the principles can carry forward or have similar practices in adults. So what we did is we layered in some prompts for parents to be able to think about, okay, you're working on this for your child's sleep, but how might you be able to turn that into a goal for yourself or even a family goal? And we think that will help families be more successful in implementing it if you're trying to, not just work on one family member, but maybe make it a family project, because it is such an important resource for mental health and coping right now, that we thought it would be important to add it in. So two modifications. The first was a little bit of information about COVID-19 and sleep, and the second was adding in information about sleep. And I actually see Dr. Céline Bastien from the Canadian Sleep Society here who helped with some of those information, because adults, it's similar as I mentioned, but it requires a little bit of tweaking. So she was able to act as a consultant.
Dr. Case, can I just add that Dr. Bastien is the president of the Canadian Sleep Society? You should wave, Dr. Bastien.
And I'll add, she is the knowledge user representative for CSS for the grant. So very involved at all levels.
Excellent. So perhaps Penny, you could tell us about this new study, which many investigators are on the line right now, to evaluate the implementation of the Better Nights, Better Days program.
So sorry, I think I had a freezing moment there. So I apologize if I talked over you, Sydney. Yeah, so we're launching tomorrow, which is really exciting. So while it took 6 years to develop Better Nights, Better Days, we were able to add the modifications a little quicker this time. So that's good. The pressure was on because the pandemic is on, so we had to do it. And of course, the foundation was all there. So that made a big difference, and it had a lot of great people working on it. But I think the program is, it's a strong program, but having this layered in information for the parents, I think is so helpful, and having that family focus and really that 24-hour focus. So what we do in the daytime impacts our nighttime, and what we do at night impacts our day. And I think, we've been able to kind of capture that in some of the modifications. So that's really exciting. So the goal for this project is not so much about effectiveness, although we do want to make sure that it continues to be effective in the COVID context and for whom it's effective. But what we're really focusing on this time is implementation and sustainability. So we're looking about how can we get this out to families across Canada? How can we get them to engage with it? How do we get them to stick with it, to adhere to the program? And who may have more difficulty doing that, who may be more successful with doing that. So we're really looking at implementation in this context, and we're looking at different ways to get that information out. So we're looking at a more traditional knowledge user way, which is what we've always done in research, and has been quite effective. So the Canadian Sleep Society will really be helping and pushing out the information about the program, and helping to recruit into the study through their many different networks and connections, and that's going to be really exciting. And we're also looking at a different way of doing it, which is through marketing research and digital marketing. And so we're looking to see, who does this reach? Do we reach different families this way? I don't think it's a comparison so much as a synergy. Maybe we'll reach different people in different ways and be able to really get the information out to families across Canada. So that's really exciting. And then, so in terms of more of the practicalities, when families hear about it, they go to the website, they can read more about it. We have lots of information on the website about the program and the research study. And if they decide to participate, then they just click a button that says, I want to participate, or what have you. And then they have to do a little bit of the research piece, but we really try to keep it streamlined so it's not so intensive or time demanding. So there's a short screener just to make sure it's an appropriate fit for the family. And then they have to obviously do a consent to make sure that they understand the limitations in terms of the research and security of the data and that sort of thing. And then they can have access to the intervention, and the intervention is 5 sessions. Yes, it's 5 sessions. I always forget that. It's 5 sessions, and it walks through kind of a very stepped approach. So first sharing information about sleep, and then healthy sleep practices, and then more targeted specific interventions, and then looking at kind of how do we maintain the gains that we make. And it really is focused for children who are having difficulties falling asleep and staying asleep, and maybe waking too early. So more the insomnia difficulties in terms of their sleep. And so we're going to be recruiting for 3 months to try to get 1,000 families. So we're set the target high, but we have faith in our collaborators to get the word out there. So hopefully we'll be able to do this. And yeah, so the goal really is to get it out there. And then the sustainability part is, once we know how to meet and reach all those families and get them engaged, how do we continue with this program over time? So eventually the research has to, will probably stop, and it has to be funded somehow. So we're looking at different models, but one of the models is a direct to consumer kind of approach. can we support the program that way? How about embedding it into different organizations, for example? So there's lots of approaches that we can consider, but it is really important that we can generate the revenue that we need in order to keep it current, up to date, evidence-based, and support the technology as well. So it's a kind of the last part of a research and development program. We've done the development, we did the effectiveness research, and now we're looking really at implementation and sustainability. So it's really been an exciting journey to kind of go from start to finish for a program like this.
Thanks, Penny. And we have copied the URL into the chat for the research website, should you want any more information about the study and instructions on how to enroll once we do launch. So finally, Shelley, what do you think that the impact of this study might be?
Thanks, Sydney. So I'll talk about the impact in 1 second. I want to say, we will answer your question after the panel, and hopefully everyone will stay around for the next 17 minutes, because there's a really nice prize, and there's only about 10 people, so you have a 1 in 10 chance of winning. So first, before I talk about the impact, I just want to mention, thank you for joining us tonight, everyone who's on the call. We wouldn't be here if it wasn't for Dr. Corkum. So she has really led this huge development. She's really an international leader in pediatric sleep. And this is going to be a great opportunity for, Penny didn't know I was saying that.
No, I would have ixnayed that if I knew.
So this is going to be an amazing opportunity for 1,000 families to have access to this intervention that really Dr. Corkum is like a brilliant scientist to have developed. Okay, so now I'm going to talk about the impact. So I think probably, I'm not sure if, we're all parents and also clinicians, so I don't know who's on the call, who's a clinician or parent, but if you aren't in clinical science, I'm just going to say quickly, what happens with a lot of science is that people spend a lot of time developing something, and then they publish it, and they might go to a conference and give a talk about it, and then they go on to the next thing, and the intervention isn't always used. So this is like a really important study for 2 reasons. One is to see if we can help families with these modifications for the COVID pandemic and the situation that you heard about tonight. And the second thing is, like, how can we sustain this intervention and really help the 25% of Canadian families who have concerns about how their children sleep. So that's like a lot of people, and about 80 to 90% of Canadian families have internet access. So you can imagine that there's a huge potential, which is what we're going to learn through this study about sustainability and how to implement and how to get intervention out to families, that is really going to have a huge impact. And I'll just go back to saying it's because of Dr. Corkum. I'll just end with that. And just one more thing is about the impact. So it's a really great evening, because tomorrow is World Sleep Day, and this talk really aligns with the goals of World Sleep Day, which is to raise the awareness of the importance of sleep health. And I think everyone who's listening tonight, because you've taken an hour out of your time, knows that sleep is so important for everybody, but particularly for children, because if children don't sleep, it has implications for learning, behavior, emotional health, emotional regulation, physical health. So it's just really important, and it's just a perfect alignment of talking about our study just before World Sleep Day. So I think it's going to have the study's going to have a big impact. Thanks, Sydney, for the question.
Thank you, Shelley.
And I was thinking, I'm going to jump in. I don't know if that's allowed, but I'm going to do it. Maybe Dr. Bastian could talk a little bit from CSS's perspective. Why are you willing to support this type of research? It's it is a really big undertaking. Like, they're literally going to be, promoting this study. And so, I think it'd be really interesting. Like, what do you see as the benefits of having a program like this out in, like, for Canadian families?
Well, of course, because you are the initiator and because of your expertise and all the success of the program so far, I see that families, can really benefit from this program. And it's time that with the COVID, we have seen, and I think everyone here recognize that COVID has been really hard on sleep. We see sleep difficulties in each age range, going up. And it's time to recognize that sleep is one of the pillar of health, and that in that regards, this is part of our mission too. As Shelley mentioned it earlier, it's part of CSS mission. And I do believe that the program is going to have a very positive impact, on, well, the COVID correlates, if you want to. And I know it's an implementation study, but at the same time, it's a huge undertaking, as you're mentioning. And that's why I think that it's important for CSS to also help their research, or help this kind of research, to be promoted outside, to be promoted all over Canada. So because we have that outreach, I guess that we're going to be there for you.
Yeah, and I have to just thank you and CSS, because I think, we often have knowledge users on grants. Sometimes it's a name only, sign on the dotted line, then we don't really do much with them. But this is truly a partnership. Like, I really feel like, like this is a partnership, and it's working to the same goal and increasing just even the people's knowledge about sleep and the importance of sleep. I know that you've been so engaged in that, and CSS has, along with the Canadian Sleep and Circadian Network as well. So I just want to kind of give a shout out to the true knowledge user kind of collaboration. I'm really excited to be able to be involved in that. So thank you.
My pleasure. And I'm sure that even if we don't recruit like 500, or so families or so, those that will benefit, those that will be recruited will benefit. And this is going to be a success in itself,
Yeah.
So.
And it takes time. This is one of the things that I struggle with, but it takes time for the word to get out, right? Like, so, even if we don't hit that target, it will grow with time. And I think that, as when I look at, because I'm analyzing the data from the Better Nights, Better Days RCT, the feedback from the parents, like the qualitative feedback, is so powerful. And they're going to tell other parents, but it will take some time. So we'll see what we can do in 3 months, but it's not the end of the story. I don't think after 3 months we'll continue to see it grow. So that's really exciting.
And we're going to go on advertising. So yeah.
We do have time now to open the floor to the audience. So as we mentioned, please feel free to type any questions or comments into the chat box, or if you're prefer and comfortable, you may raise your hand and we can invite you to unmute yourself. And we do have one question waiting. Is this program aimed at typically developing children and families, or those with neurodevelopmental disorders? So perhaps Penny, you wanted to address that.
Sure. So we're using the Better Nights, Better Days program, we do have a program for parents of children with neurodevelopmental disorders, but we're still doing a randomized control trial of that. So this is the program for parents of children who are neurotypical. Saying that, though, we're not limiting who participates. So, these strategies can be helpful to anybody. Maybe not as much, it doesn't have like the extras that we have in the NDD version, but definitely it will lay down a really solid foundation in terms of healthy sleep practices, and also some really specific targeted behavioral strategies as well. So they can, within limits. I think that's probably what Shelley was raising her hand about.
Actually, Penny, I was going to say, we gave this program to
Oh, yeah.
parents. We gave it to parents of children with neurodevelopmental disabilities before we made the modifications. And actually the parents were very happy and felt that it helped even when it was not specifically modified for children with neurodevelopmental disabilities.
Yeah, no, that's a really good, I had forgotten about that. And one of the things that I always loved about that study was actually one of the families thought it was modified already for children with neurodevelopmental disorders. They were so pleased with it. So yeah, we did that as a usability study, and the parents were satisfied. I mean, they had some feedback that they thought, you know, it could be a little more focused for their child with NDD, but generally they thought it worked well. So yeah, we're going to keep it pretty broad. And yeah, I can't off the top of my head remember the exclusionary criteria. Elizabeth, you just
to find the unmute button. There's no exclusion criteria. There's only inclusion criteria. So the inclusion criteria is you live in Canada, your child is experiencing sleep problems, so trouble falling, staying, or early wakings, and the age, because the age is you know, a little bit, the strategies are really geared to the certain ages. So the ages are from ages 1 to 10.
So we have a next question. I have joined the call from India. Welcome, thank you. It is 5 in the morning and this is an absorbing discussion. I'm overwhelmed at this ameliorative intervention that has already been devised to ensure better sleep among children. I would like to know the strategies this program has come up with to deal with the confounders of sleep, since physical activity has reduced during the pandemic, evidently. Perhaps Elizabeth, if you want to address.
Thanks, Sydney, and welcome from across the world. This is amazing technology that we can have. So I think that the main focus of the program and the strength that we thought would be helpful during the pandemic was really grounded in that helping families establish routines and structures to their day. So there is an emphasis or encouragement of families to get enough physical activity. And we know that there's certain restrictions around the world that makes it pretty hard to do. But there's also, you know, a broader focus on eating well and establishing good like wake times and regular routines during the day. And so even though there's some things that may influence sleep, like, you know, physical activity, I think the strength is that it really helps parents identify all the different aspects they can do to include their physical activity and their healthy eating and their regular routines and keeping a positive approach to sleep. And I think Nicole probably has a really interesting story or anecdote from some of the qualitative interviews that she did. And I'm hoping you'll describe the shake a bush story from one of the participants.
Yeah, sure. And I have to say that's really one of the advantages of this kind of mixed methods approach that we took in exploring all of this, is we got some really neat stories in the process. So yeah, as Elizabeth was saying, it's interesting, kind of speaks to like the ingenuity and like the resilience of kids that they can display during times like this. And so what Elizabeth is referring to is one family who was telling me about how the kids couldn't play together, of course, with social distancing in place. So instead they made up this game called Shake a Bush, where they would each hide behind their own shrubs in the backyard. And then they would like shake the bush and then run to the other side and hide from each other, and then would try to play that way. And so it's really interesting how despite that availability of kind of structured routine physical activities, so kind of bringing it back to that theme as well, children are able to find ways to do this still on their own. So yeah, an interesting kind of component and thing that came out of this as well.
Excellent. So we have another question, wondering if there's any sort of recruitment flyer or brochure for the program that could be distributed. I encounter many families through ER coverage, etc. And great question. I know, Elizabeth, you're familiar with the study logistics, if you wanted to address that.
Thanks, Amy. We would be so happy for you to, post recruitment or the brochure. And we do have a specific healthcare provider sheet and kind of fact sheet, as well as just some broader posters that you can either print and place or hand out. And those will be available on the Better Nights, Better Days website as soon as we launch. So if you're interested in that, for the exact timing when we're launched, then we'd encourage you, if you're interested in distributing those things, just pop on over to the website and put your email in the web form, and you'll get notified as soon as the study goes live and those things are available.
And Elizabeth, can I add, I don't know if Dr. Earle, what kind of physician you are, but this is going out through the Canadian Pediatric Society, correct?
We're leaving it to our pathway leaders to promote. So we'll see how it goes. But I would say that it's all downloadable resources on the website, so you can just download it from there. Or you can always email Sydney, and she's very responsive in terms of sending along information. So Sydney, your email, I don't have to type it all out. I just hit B and it comes right up, so I can't remember it.
I will put my email in the chat here. Luckily, it's short. bmbd@dal.ca. Feel free to reach out, and I'll share any resources we have available.
And thanks, Dr. Earle, who works in psychiatry and is going to share with pediatric and psychiatry colleagues. Thank you so much.
Excellent.
We're going to make sure you win the basket tonight.
Now you can't.
Excellent. So we did have a couple questions.
There's the basket.
Submitted that we could address right now as well. It looks like we still have a bit of time. So were changes in sleep in Canada different than changes reported in other countries around the world? Elizabeth, did you want to?
I'll just speak very briefly. So we did, other countries reported that, in families that parents had more stress, the sleep had worsened in children. There was other reports of kind of more nightmares and that sort of thing that might be associated with stress, as well as that shifting sleep and wake time. So that cycle that Nicole was speaking to, in terms of, a little bit later bedtime, a little bit later wake up time, just kept getting later and later, was also observed.
Great. And I think perhaps a final question for this evening. Does the program include a coach, or what supports are available through the program itself? Shelley, did you want to address that?
Sure. So the way the program was developed was actually not to have a coach, because that would lead to a more sustainable program. But it's a very sophisticated computerized program, so that even though there's no coach, parents get individualized feedback depending on how they answer questions and how they fill in certain information. So I guess you could think of it like a chat box of sleep interventions, because there's individualized feedback without a coach.
Yeah, and I'll just add to that we actually have a coach who's in the program. So she's both a cartoon and a real person who kind of guides the parent through the program. So I think that's a really nice component. And what we did, because we knew we wanted to develop a program that we could sustain over time, and we felt like if we had to have like a whole room of coaches, that would be very difficult. So we really spent a lot of time thinking about what would a coach do? How would they support a parent? And then we created something called roadblocks. So we put in the roadblocks section the types of barriers that parents might experience when implementing the strategies, and then the type of feedback or support that a coach would have given a parent, so that they are still getting a lot of that information, just not kind of through a more traditional coaching approach, but it's all built into the system. And it is a pretty tailored system. So depending on the child's sleep problem, depending on the parent and the family's wishes around how they want to intervene, different strategies and different program plans are generated from the intervention. And so it is a nicely tailored program for sure.
Great, thank you.
Sydney, maybe take the slide down so when the person wins, they can share their video if they want. We can see the excitement on their face.
All right. So with that being said, the moment we've all been waiting for, we have conducted a draw. We have selected an attendee using a random generator, and the lucky recipient of our door prize this evening is Stephanie Yu. So congratulations. And we will be in touch by email through the email address you provided through the registration for this panel to confirm your shipping address and arrange to get that to you. So this concludes the panel this evening. Thank you very much to the panelists, and thank you to the audience for attending and for a wonderful discussion. And if you do have any additional questions about the research program, we invite you again to visit the study website or contact me at bmbd@dal.ca, and we can address any outstanding questions. So thank you, good night, and take care.
Thank you.
Great job.